We found evidence that higher BMI is associated with a substantially reduced mortality following hospitalization for infection, including pneumonia, urinary tract infections, and sepsis. In contrast, being underweight increased the risk of death. Part of this association is likely related to undiagnosed comorbidity. My name is Sida Bjerg, and I'm a medical doctor and a researcher in clinical epidemiology. I'm one of the authors behind the article Body Mass Index and 90-day mortality among 35,406 Danish patients hospitalized for infection. We identified 35,600 patients with an incident acute inpatient admission for an infectious disease. We examined the 90-day mortality in association with underweight, overweight, and obesity versus normal weight as reference. We found that the overall 90-day mortality after hospital admission was high. It was 10% for any infection. In this large population-based hospital care study, we observed markedly lower 90-day mortality among patients with higher BMI compared to patients with normal weight. The adjusted hazard ratio was 0.64 for patients with overweight and 0.55 for patients with obesity. In contrast, the adjusted 90-day hazard ratio for death was almost double in patients with underweight. It was 1.75 compared to normal weight patients. Mortality reductions with overweight and obesity were consistent for all major infection types and remained robust independent of recent weight changes, smoking status, or comorbidities. Mortality was highest in patients without any apparent reasons such as smoking or known disease for their underweight, suggesting a role of undiagnosed comorbidity. It is possible that obesity may have a protective effect in acute infections. However, in the general population, obesity is associated with increased mortality. Thus, the protective effect of obesity in acute infection may not outweigh the overall risk. Furthermore, we found a high mortality associated with those patients who had underweight, which may be important in a clinical setting. Several mechanisms may explain this survival benefit among people with overweight and obesity. People with obesity may have large energy reserves due to obesity-associated low-grade inflammation. The immune system may be primed to respond to infection. Our findings also indicate that underweight may be a marker of unintended weight loss in some patients related to poor underlying health and undiagnosed comorbidity rather than the direct cause of poor outcomes. This study is a part of a project on the overall risk associated with overweight and obesity. We also plan to examine different other aspects of obesity, including long-term risk of death, cardiovascular disease, and mental disorders. Thank you very much for your attention. I hope you'll find interest in reading our article on this association between body weight and mortality after an acute infection.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.